And thanks for the opportunity to be able to present some of the work that we've been doing over the last few years, really, that is all supported by Macmillan Cancer Support, the national charity that I'm sure many of you will be well familiar with. So it's brilliant that we've got my colleague Ruth here from Macmillan, and Ruth is going to be co-presenting. And also, I've just spotted our other colleague from Macmillan in the audience as well. So welcome, Caroline. And much of what I'm going to be talking about, rather than go into the detail of the individual research studies, we're going to be really talking about the added benefit of the relationship that has developed between the university and Macmillan over the since about 2014 really, and the kind of added benefit that that partnership is bringing on top of actually the delivery of the research, but all the other things that have come out from that, from our perspective as academic staff, but also from the perspective of Macmillan, hopefully. The positives. Okay, so we have been really fortunate in that over the last few years we've built up a body of research that has been supported by Macmillan, some of it also supported by other organisations such as the Bronhead Trust, and also match funded by the university, by the School of Health and Social Care. So there's a range of projects, one of which was actually done by colleagues in sport and exercise science, and the others have been within the School of Health and Social Care, but have had input from colleagues wider, further afield as well. And this is just a flavour of the research that we've been doing, and we're really starting now to build this body of work within our research group in the School of Health and Social Care. And you'll see from the titles of the study, lots of it is to do with working with people that are affected by cancer, and that might be the person with a diagnosis themselves or a past diagnosis, but also other people that are affected more widely, such as family members or carers, and so on. So we've done a range of studies, some focusing specifically on carers, some focusing specifically on social needs of people affected by cancer, and the most recent study also looking at learning and development needs, and working to develop a body of resources to support learning and developing needs of people affected by cancer, and also a big, quite substantial project which is actually a foundation for a PhD, which is really looking at issues around self-management of people affected by cancer. And one of these other studies, the one in sports science, also provided the facility for an MRes student. So through this funding, we've been able to support a PhD, which is almost at completion, and a master's by research as well. And these studies some of these are complete, they're at different stages of completion, but they are now being worked upon, written up, disseminated, and so on. So in terms of the actual benefits, one of the really key benefits is that Macmillan have funded a post, so a research assistant post, known as a Research Fellow, which is, I don't want to embarrass you, David, but it's David Nelson is in that post. But because it's funded by Macmillan, it is more than a kind of regular research assistant post, if you will, because he has access as if he were a Macmillan employee. So what that means is that David is in a really fortunate position in that he's been able to access a whole range of resources. Macmillan is well known for its quite prolific educational resources, some of which are online, but actually through this position, David can access all the resources that are available to Macmillan staff for training and so on. But additionally, also extra funding, so bespoke kind of package of funding that can be used in a variety of ways to support maybe extra research training, but also collaborative activities, conference attendance, which is obviously really important for networking, to help to develop this body of work moving forward, but also for dissemination as well. But another key benefit is Macmillan have got a really well-established network of health professionals nationally, and actually we are able to kind of access those clinical nurse specialists as resources and expertise, but also through connections with the Macmillan staff, we've been really fortunate to be able to access patient groups. And we've heard a lot this morning about public involvement in research from Mo and from Coral and from Kay and so on. And we're really lucky in that actually that's something we've been able to do with this work from the outset, really. And that is through that link, that direct link via Macmillan. So we're able to have patient representatives on the steering group for the biggest study here, which has been a 3-4 year study. And we've had a patient rep on that group right from the beginning, who has been really instrumental in feeding into ideas about study design right through now to dissemination and impact and so on. And also other patient groups, so patient support groups that are existing across the East Midlands, and we've been really lucky to be able to access those people to have their view and their input into the design of study materials and so on. And I think there are, I'm not going to go through all of the benefits, I've just flagged them up here, but I think the key one is that added funding and that added facility to really network widely and have that expertise to feed into the study design right through the whole process. And we've heard a lot this morning about engaging with the press office at the university when it comes to dissemination and developing communication strategies for research. And again, with Macmillan, we're in a position to be able to access their national comms team, and we're working with them at the moment to really get together a robust communication strategy for the outputs for this research. Not just for kind of promoting the academic outputs, but really trying to get the range of outputs right in terms of reaching the right audiences, and that's something we're going to be working with Macmillan really closely on. And another kind of outcome from this collaboration is that we were, a few years ago, as members of our research team, were invited to be on the steering group for the development of a strategy for living with and beyond cancer in Lincolnshire, and our research fed into that strategy, but we were also active participants in that steering group, moving that work forward. And because of the connections, we've also been invited to speak at other organisations to disseminate this work. And we've been approached by other academics as well. So now that the work is out there, we've been really lucky in that people have been proactively making contact with us, and that's led to collaborations across as far as La Trobe in Australia. Somebody looked us up, and then we got together virtually and actually put in for some poster presentations at international conferences and so on. And similarly, there's a research group at Southampton whose work, they're a really well-established research group looking at self-management of people with cancer, and a lot of their work has really underpinned our thinking, and we're going to be going down to meet with them soon. And similarly, there's a group in Bristol as well. So it's really provided us with that platform to start to develop a body of work here at Lincoln to do with looking at mainly the sort of social needs of people with cancer rather than the kind of medical side, and then to develop that work moving forward as well. And it has led to new ideas for subsequent bids, which Ruth is going to talk about some of the work that we're going to be planning moving forward as well. And just briefly, one of the big events that we held recently, some of you may have been there, Macmillan had a cancer summit, which is going to be an annual event, and it was actually hosted at the university just a few weeks ago. And Ruth's going to give you some of the details of that, but it was really well received. I think Macmillan were really appreciative that the university offered the facilities, such that we've actually booked it again for this time next year, and it's going to be in the Isaac Newton building this time as well, so an even bigger audience. So we've been quite ambitious there, but I think it was really well received this time. Okay, so I'm going to hand over to you now, Ruth.
Brilliant, thank you. Can everyone hear me okay? Yeah. I was going to say, someone mentioned insomnia earlier, and my dad used to work shifts, so I was always quiet at home, so that's the one thing. I'm just going to try and raise my voice a bit, but shout if you can't hear me. Thanks, Ros, that was really helpful. So in terms of the Cancer Summit, this built on the successes from last year. We worked closely with the Living with Cancer programme in Lincolnshire, so some other services where we've been involved in a partnership and invested in them to be able to improve care for people living with cancer. The first Cancer Summit took place in 2018. Ultimately, this is about bringing together our system leaders, our clinicians, our people working with and supporting people living with cancer and their loved ones in the Lincolnshire area. So it's a real chance to bring together and think about where are we at, where are we driving transformation, and actually where can we celebrate successes, but also think about the future. So at the event we had in early June, we managed to hear about, we were fortunate to be able to hear about some of the latest developments in cancer that were taken forward in Lincolnshire. So at ULHT, at the Hospital Trust, they have started doing work around radiotherapy treatments and how they can actually improve that in terms of breast cancer. So slightly improving the experience and reducing some of the negative effects of radiotherapy for those patients. We heard a number of fascinating recollections from people that had gone through a cancer experience, and that really helped us to think about, yes, there's pockets of really good work, but actually there was a stark reality that we're not there yet. There's still a lot of poor outcomes, poor experience, so a lot of work still to do. But also we had a number of workshops, and certainly Ros and David presented on one of those workshops, and again it was an opportunity to share their findings and have those discussions with local people in the area and the system to understand actually how could they improve services again and actually improve their dissemination, how their work is going to be taken forwards. So just to take you back a second and put some context back into this, if I was to ask each of you in the room to turn to the person next to you, there's a good chance that based on the current stats, at least one of you would face a cancer diagnosis in your lifetime. We're looking at 1 in 2 in terms of the current predictions for cancer diagnosis. For a number of those people, effectively we've got changes in terms of detection rates, we're picking up cancer more quickly, but equally we've got more people that are, as a result of the advances in treatments, more people that are living with cancer and living with the consequences of cancer as well. That's not just at any one stage in the journey, it can be right the way through from start of diagnosis, right the way through treatment. And for those that are living with cancer for a number of years, we can sort of look at living with cancer can be 5, 10 plus years, dependent on the stage and engraving of that cancer. But for a number of those, that can take many impacts in terms of the impact on them, on their health, physical, emotional, psychological well-being, but also financial. There's a lot of different challenges for a person that faces a cancer diagnosis and their family around them. Macmillan is a national charity, absolutely recognise that, and we know through the work that we do that there's significant impact on those people, but it's actually how we can support and help everyone with cancer to live life as fully as they can. We may be national, but actually we make no impact unless we work locally. So for us, it's really imperative that we work with our local partners and we work in that local area. So some of the things that we've been doing over the last 12 to 18 months are listed up there. I won't go into any great detail. I'm happy to talk about some of those. I guess some of the particular ones, just to highlight, as Ros mentioned, some of the work that we're doing with people that are affected by cancer, actually what better way can we do it through a co-production group. So this is where we start to engage with people that have had that lived experience, and we work closely with them. The group has just been set up, it's going through its 3rd meeting. And we're asking those people to work with us to actually look at how can we improve services, how can we change services. We've got a new Macmillan Cancer Support Centre that's going to be built at Lincoln County Hospital. They did previously have a centre, and that had moved through a number of challenges at the trust themselves, but we've got a new centre that hopefully will be able to support people in their going through their journey as well. So particularly my role in terms of working with Macmillan and working in this area is around working across the system, across different organisations, different professionals to be able to improve those services. And I would say, as Ros alluded to, we support a number of professionals, but in Lincolnshire we've got around about 100 professionals, so nurses, GPs, allied health professionals, academic researchers as well. Obviously there's a number of different roles there. Over the next 12 months we've got a number of things that we're trying to work on as well, and just a couple to pick up on really, as Ros alluded to, we're trying to look at our learning and development offer, if you like. We've got what has been recognised as a really strong offer to our professionals, but also to people living with cancer, to help them to develop and establish some of the skills, some of the knowledge for them to live with the long-term effects of their cancer. So over a period of time we have had, it's difficult to call it a learning prospectus for a patient, but it's something about actually what do they want, what would help them to be able to cope more effectively with their cancer diagnosis and the long-term effects. But we can't really understand that unless we ask them. So that's a piece of work that we've got that will be kicking off over this next year, just to start looking at some of the output from that and how we can start to change our offer in response to that. Another one is the information support services. So whilst we'll have the new centre at the county hospital, what we know through the work that David has done looking at comparison of rural versus urban area is that actually it's quite difficult in Lincolnshire to just pop across the Lincoln County Hospital to get your information and support. There are centres at the other main hospitals, but that's not enough. Obviously if you're out in sort of beyond into Lincolnshire coastline, it's quite a trek for a patient to be able to go to that. So we are looking at ways in which we can improve those services, be it through digital, through that one-to-one support and through other providers, other professionals that are part of the services as well. I think the key bit that when we were talking about putting together slides for this, we talked about and thought about what are the benefits of partnership working. And Ros has already mentioned a number of those in terms of the benefits for David as a Macmillan professional potentially and for the university. But we also talked about from that mutual benefit, what it means for us at Macmillan as well. So very much for us it's around partnering with local organisations where the knowledge is that local knowledge, that local credibility, and that support within local economy. As I say, we're a national charity, but actually unless we get really down into the grassroots of the area that we're working with, we can't really have that true impact. We try and make the best use of resources, because I certainly haven't got the skills to go out and do research. That's up to the people who know how to do that. So for us, it's really important that we really make those really good, strong partnerships with organisations that can help us to do that, to help to do the research that then helps us to move forward in terms of how we can support people. So it's that specialised expertise, it's the knowledge and the skills. We've talked a number of times through different presentations about impact, but for us that has, again, a number of different meanings. It's about that collective approach to how we can make that sustainable change, people living with cancer, so looking at the services that we're developing, how we can improve them. But also it's looking at how those partnerships will work and how they can make a difference. It challenges us to think about doing things differently as well. So we can't just keep doing the same old thing. Certainly in Lincolnshire we know we've got significant workforce crisis in terms of the nursing workforce. So again, one of the things we're looking at is how we can do things slightly differently and look at a different skill set across teams. The other part for us is around extending reach. So certainly even though David met with a number of people in terms of the research he did, it wasn't just about collecting the information from them. Sometimes they identified needs, and for us it was about David then being able to put them in touch with other services to support them with their ongoing needs that may have otherwise been unmet had David not been involved in the research. So again, it's that reach that we've been able to reach out to more people, and through our professionals they're aware of what's available, what the offers are. So again, it's that expanding the networks. It also raises the awareness of cancer amongst the participants, so through our professionals, as I say, but also that broader reach, so through the networks that the team have been able to link into, through the other groups, the steering groups, being part of the Living with Cancer programme as well.